How y'all doing? That's good. When I first got the invitation to speak, I tried to give this to our health authority, Dr. David Pearce, who some of you might know, and my deputy health authority, Dr. Janita White. I said, we're going to be speaking to a bunch of medical personnel, so I think you should do it. I've been out for a while, but when I got back, I found out is they had punted it back to me. I wasn't even in my office yesterday when they put together a presentation. And Tucker, who's our public information lead, told me that they approved it. And it's like, why would they approve something that, I told them to give? So here it goes. I just left downtown where I'm going to talk a little bit about the content of that meeting. But then I knew that it was on Bates, and we drove up, I found out it was the hospital. So I had an emotional reaction to that. Hey, Steve. Because last time there were two times that I was in the hospital here. Both of them was the emergency room. I remember the first time I had cut my toe, and my goddaughter, who was actually in med school at the time, when we were in the ER, I asked the doctor, told her that she could sew up my toe, but she was too nervous and she wouldn't do that. The second time was when I let my blood pressure go out, and I had to stay in the ER for about 6 or 7 hours. So it's like, oh God, this is really traumatic. And then the third thing I thought about was the fact that somebody told me there was a bunch of cardiologists that were going to be in the room. And I've had a very up close and personal relationship with a cardiologist for the last 13 months. And the last slide that I show you will tell you why I've had that relationship. And it's going to be an ongoing relationship. I can tell you even when my next appointment is. I think it's February 28th, and it's around the corner. I'm assuming the right click is forward. So, I was looking at the data that was presented, and we have a lot of that duplicate data. And the thing about public health is we're looking not only at individuals, but we're looking at populations. And what I think government's role is not exactly the role that government should play, because we know that most folks die of chronic disease, right? And if you look at where our investments are, it's certainly not in that arena. It's mostly on the regulatory part, and even local government. Our general fund primarily pays for our clinical services as well as our laboratory services, which is great because we serve as a reference lab for the 17 surrounding counties. And I can tell you that every time there's been a new disease or a condition, our lab has developed the capacity to actually do tests for that situation. I always have to do this because when people think about public health, they see that we have clinics. The first thing they think of is that we're somebody's doctor's office. Well, we are, but only in certain cases. Our primary goal, as you can see, is to prevent illness and injury, promote health and well-being, and protect the community overall. And what has really been, I think, at the forefront of what we've been doing in the last 20 years that I've been here is we've been responding to a whole lot of disasters. We're just coming into peak hurricane season, but my department has been activated at least 3 times already this year. Imagine what that situation is like after coming off of 3 years of COVID. And by the way, people are still catching COVID. People are still dying from COVID. I can tell you that I was able to avoid COVID for about 3.5 to 4 years. I went to my high school reunion in Waycross, Georgia, which has a population of only 12,000 people in the whole county. And guess what I brought back to Houston with me? COVID. I had symptoms. I immediately went and got tested. And of course, I stayed home. And for some reasons, I couldn't take packs of it. So this is our vision and our mission. And the bottom line here is that we as government can't do everything. We have to do it in conjunction with partners. And those partners vary from community-based organizations, other governmental entities, and even some private interests. One of the things that we've done, oops, I went too far, but I'll catch up. One of the things that I did probably more than a decade ago, was set up a Houston Health Foundation. And the purpose of Houston Health Foundation was actually to raise money for programs that I knew that our general fund would not support. For example, we have a vision program called C to Succeed, where we've seen over 100,000 school-aged children. And we've given close to 98,000 free eyeglasses by raising private dollars. I spent 3 years denying that we were even in the business of optometry, but after having done that for 3 years, recognized that that was something that we were going to embrace. Oh, Stephen, why did y'all jump into that business? It's an expansion. Well, the reason that we did it was because, do you realize that the schools are required to do vision testing for select grades? Well, guess what? They do the vision screening. A significant number of children fail the vision screening. What do you think happens after that? The state health department collects the data. When I found that out, I said, oh my Lord. Matter of fact, we had to wrestle with those suckers to even get the information. And so through our foundation, raising some private money and using some 1115 waiver money, we developed a program. And we went from seeing 400 kids a week to being able to see 400 kids a session. And we're also working with a private interest in Fort Bend County, trying to help them develop the capacity to do that, because that is a good thing to do. Certainly, most people confuse public health and medicine. Y'all know the difference. We're really, and the first thing that I did when I got here, because there was some interest in trying to eliminate our clinics. It's like, no, we cannot eliminate our clinics, because, and I use the example, I say, well, our clinics, they're not really specialty clinics, but they serve as specialty clinics because, you know, not all practitioners actually know how to treat TB. As a matter of fact, we contract with a number of specialists within the Med Center to serve as consultants for us. So we still run clinics, but they're primarily for the purpose of providing immunizations, family planning, STD testing, treatment, HIV testing. We do dental and family planning, and I said as long as we're in Texas, we'll continue to do dental and family planning. You can imagine the number of seniors that actually go without dental treatment. I can show you a list. You've already heard a presentation regarding factors that influence health. Always have to show this to folks to illustrate the fact that there is a need for some of the work that we do that's non-clinical and non-environmental health. This is the reality that I live in. The federal government has the money, the state has the authority, and we have the problem. And imagine the bureaucracy that we have to go through in order to get access to the dollars to actually solve issues. When a problem arises, whether we have authority over it or not, a perfect example would be the cancer cluster in Fifth Ward with that Union Pacific creosote site. We have no authority whatsoever over that. But guess who they're looking to solve that issue? The local health department. These are some of the service activities that we participate in. If I were doing a more in-depth presentation regarding my department, it would take probably about an hour, so I'm not going to do that. Y'all can read, so I'm just going to go straight through this. This illustrates also the collaboration with the state, federal government, the local QHCs, the CBOs, and other jurisdictions where we see ourselves as being in the middle of that. This is my organization chart. If you want it, there it is. You can see the complexity of it. Actually, we call ourselves the Houston Health Department, but actually we were Health and Human Services when I came here 20 years ago. When we had to go through our accreditation process, we had to talk about branding, marketing, and whatever. Health and Human Services just weren't cute enough, and it was too big to put on a banner, so I said we're going to simplify this, the Houston Health Department. We do everything from inspecting restaurants, air quality monitoring, to running the WIC program. We run the Area Agency on Aging, where you see these Meals on Wheels trucks that are going around. Well, we fund most of that. Senior nutrition programs, we fund those too. There are things that we're involved in and that are on the social side that actually have a tremendous impact on our community. For instance, we run the largest reentry program in the region. If you look at the recidivism rate of our program, which is in the single digits, and you look at recidivism rate at the state level, which is about 20%, you will know that there probably needs to be a greater investment in that. Things like Nurse Family Partnership, which is a national initiative, gets a lot of political support. That's one of the things that we're involved in, but it's not at the scale in order to make an impact. Community health assessment is something that we do. And basically, a lot of this is we do it through running focus groups. We also send out surveys. And if I'm going to the next slide, we have a portal that you might be interested in. It's called State of Health Portal. We partnered with Harris County and the Healthcare Alliance at one point to create this, and we had hard copies of it. But now this is really online, that has population-based data. And you can actually go to this website, and if you want to look at a certain zip code, if you want to look at a census tract or whatever, you can look at data, health-related data according to this. And it's updated. We actually buy this we have bought this application from a company that continues to update it. And we tap in to a variety of different sources in order to do that. I can ask whoever to actually send you these slides if you want to get those. You've been hearing a lot about cooling centers lately, right? In the wintertime, we were running centers because it was too cold. Now we're running centers because it's hot. That really speaks to our concerns regarding the environment itself. It really speaks to the fact that when you look at social determinants, that the environment really influences the environment that people live in really influences access. It really influences people's quality of life. And I have to tell you, one of the challenges we have both with the cooling centers is that a lot of people don't go. Now, during the hurricane and during the derecho, they did go more than we expected, especially during the last hurricane. But a lot of people don't go because of issues related to security, although we do provide transportation to them. We certainly run the cooling centers, but libraries and parks facilities are also open for them too. Just to give you an example of what our involvement, I'll just track this out, and our public health role. I don't know whether a lot of you from Houston or not, or how familiar you are with the community. But in 5th Ward, there is a railroad yard. And back in the day, and they still do this, but they do it in East Texas now instead of in the middle of the city. The railroad tires, we used to call them cross tires, are actually treated with creosote so that keep the bugs away and keep them from rotting and decaying. But Southern Pacific Railroad had dug a pit over in 5th Ward, and they literally dumped the tires in a pit and they laid them on a rack to dry them out. Well, they closed that pit several years ago, I think in the 70s or 80s, but there is a creosote plume that has etched into the neighborhood. And community members were complaining about people getting cancer or whatever, you know. In public health, we say we rely on data or whatever. So I'm saying, well, yeah, they're saying that, but you know, there are other things that can cause cancer or whatever. And so they kept talking about it, kept talking about it, kept talking about it. And then grateful for Representative Sheila Jackson-Lee had confronted the state health department and say, why don't we look at the cancer register and look at the prevalence of cancer within that area. Well, when we got the initial data, we looked at it and it's like, it didn't look like there was much of an issue, but I looked at it and I don't consider myself a scientist. And it was obvious that they had included a much larger population of folks than they needed to. What does that do? It pretty much waters down the information. I mean, it dilutes it. And so I asked, and actually our chief environmental scientist, Dr. Lauren Hopkins, who actually is a professor at Rice, is on our staff and been working closely, I mean, really to lead on this. And I asked her to work with the state health department and look at concentric circles outside of that plume. When they did that, guess what they found? There are 5 cancer clusters around that plume. Earlier I told you there are things, people look for local government for solutions, but we don't have the authority. Well, guess who has regulatory authority over the site itself? TCEQ. If you go outside of the site, EPA has regulatory authority over that. But who were people looking at? The local health department. So when we saw that, at the same time, someone who was an engineer who was really close to this issue actually contacted the mayor's office. And I called him back and they said that they had data about materials that had been used in extending the creosote. And Lauren looked at it and she said, Stephen, if this is true, there's probably dioxin in the soil. I said, really? She said, yes. And so, of course, TCEQ wasn't going to move on it. EPA didn't move on it because with all this testing that they had done, they didn't seek to go further. So hopefully you can tell now, I'm very much Southern, South Georgia, a country boy. It's like, what does it take to go and dig the dirt up and do the testing? She said, well, we could do it if you want to. I said, okay, go dig the dirt up and do it. So we hired a contractor to do it. They took too long, so we sent our environmental guys out to do it and sent it to the lab. And Lauren said, well, Stephen, if we do one test and we find dioxin, do you know what that means? I said, no, not really. She said, the likelihood is like little to none. Guess what happened when we did that one test? We found dioxin. And so the initial thing with the agreement with the contractor was that they were going to test about 50 different sites, and they did, and about 30 of them came back positive for dioxin. That's exactly what we needed because we were able to present that information to EPA, and they are now involved in that. So that is the role of public health, to really look at situations within the community and to be an advocate, to be a catalyst, to really, kind of push the envelope in order to get a response from those folks that are responsible for these kinds of situations. So where are we with that now? Well, EPA has compelled Union Pacific to do further testing. We know that where the plume is pretty much because TCEQ has tracked that. And if the dioxin levels are in certain parcels are above a certain level, then they will be compelled to clean it up. And we have worked really closely with the community on this thing. And I'd like to be able to say that it's been really smooth. But when you're really trying to explain to people why you might be able to take actions on this site versus the site that's next to it, it gets really complicated. And that's going to be one of the challenges. To study, the testing should conclude by the end of the year. And we'll see to what extent EPA will compel Union Pacific to clean up certain parcels. I gave that as an example because that is something that illustrates what a lot of communities are facing from an environmental standpoint. Waycross is my hometown, is a railroad town. And the adjoining county, there's a cancer cluster for young children because of how they dispose of the waste from that diesel repair yard that's centered in Waycross. But from a public health standpoint, yes, we can treat people individually because we're trying to protect the broader population. But it is imperative that we take a deeper look at situations to ensure that we're just not putting Band-Aids on issues, that we're really trying to really fix the problems. And one of the ways that we can do that is by working very closely with the community, working so that they can really empower themselves to become advocates for their own light. And one of the purposes that we serve is to give them data and information so that they can be effective in doing that. I think that it's really important that public health and healthcare develops a closer relationship because, and we face that even in our clinics. Of course, we have a lot of repeat customers, excuse me, in our clinic. And the question is, what can we do to really influence the change in behavior so those patients are not necessarily repeating patients? I applaud you on your efforts because I think that, healthcare is very complex. I think that our system is complex. And as I said, I've had a very close up and personal relationship with the system for the last 13 months. And I've actually gotten an education. That was me 13 months ago. That's what my cardiologist said. He said that some people just don't make it. Could you believe, and actually Perse is using this as a training tool for some of the EMT techs because I called EMS and I called him too because he wanted to make sure that they didn't talk me out of going to the hospital. But can you believe that a week before I had ridden a bicycle from Galveston to Houston, and the week before that I had gone on a practice ride of about 45 miles. We're assuming that that developed over about 3 months. It was 3 months after I had a procedure done on my knee. I thank you.